Earlier this month, the CDC announced a big change to their vaccine schedule. They dropped about a third of recommended childhood vaccinations. So what does this mean for us locally here in Las Vegas? Today on CityCast Las Vegas, I talk with Dr. Rosanne Sugay, medical epidemiologist at the Southern Nevada Health District, and she explains the impact of these changes and how Las Vegans can continue to stay safe and healthy this flu season and beyond. It's Wednesday, January 21st. I'm Sonja Cho Swanson, and here's what Las Vegas is talking about. Hi, Dr. Sugay. I know you said I can call you Rosanne, so I'll call you Rosanne. Yeah. Hello, Rosanne. Welcome to the show.
Thanks for having me.
And we're so glad to have you here. Did I get that right in the intro? Is it still flu season right now? It feels like, I don't know, is winter almost over? I don't know.
Right? This is the nicest winter in Vegas ever.
Yeah.
Right? You could wear shorts. But yes, it is officially still flu season.
Okay.
Flu and all the other respiratory viruses.
Fun times. Until like when? When does flu season even end? Is there an official, is it sort of like when Mojave Max emerges from his burrow? Is that the end of flu season?
Yeah. So there's usually a period of time where we look at flu season from about October to about like March. So it's MMWR week. So it's just kind of this weird CDC week countings of when we typically see flu. So it kind of moves every year by a couple of days. Mm-hmm.
Okay. So it's like on the lunar calendar and not the solar calendar or something like that.
Sort of like that. It's just it's a health calendar counting.
Gotcha. Yeah, that was a joke, by the way. Please do not observe the lunar calendar for your health yes, hopefully not. Schedule. But back to the big news of the day. I mean, we just saw that the CDC made these big changes to its childhood vaccination schedule. I think it went from about 17 or 18 recommended vaccines to just 11. What does this mean for Southern Nevadans?
So the good news, though, is that we still have all the vaccines available and we're still able to recommend the vaccines, all the vaccines we've had. So if you roll this back to, I don't know, January of last year, whatever vaccines we're recommending are still available for all people in Southern Nevada.
Is SNHD still recommending the full, I guess, scope of all 18 then?
We're going to be recommending it and having those discussions with our patients when they come in.
Okay, so basically locally, it's still part of the local recommendations. They're still all available. Which vaccines actually dropped off the list then out of those 18?
So it's a little bit nuanced, right? So we recommend it, meaning we'll talk to patients about all the vaccines available. And really the difference that was in the ACIP guidelines was that they took things down from being universally recommended. So like if you walked in and you said, oh, I've got a 2-month-old, what kind of vaccines do they need? I would just say, hey, they need all these vaccines. Here's the list. Here's the list has changed just a little bit where now something like flu, if you had a 2-year-old, the new ACIP guidelines would be like, oh, you need all these regular childhood vaccines. But then, for flu, let's talk about whether you want to give it to your child or not.
I see. So it becomes more of a conversation.
Correct. So 6 went from universally recommended to let's have conversations about these vaccines.
Okay. And I'm seeing on this list here, I'm seeing flu, COVID-19, rotavirus, Hep A, Hep B, and then meningococcal. Some of these sound kind of serious. I mean, should we be worried about kids not getting these vaccines?
And again, that's about having that conversation with your providers. If you sat in front of me and you said, do I need it? I would say, yes, let's talk about the risks and really risk benefit wise, you could get really sick. There's not a whole lot of downside to getting a vaccine. You should get it. I think the question is in terms of access points. If you think about where people can get their vaccines, for sure, if they're here and they come to us at the health department, we'll have all those conversations with them. But we have to have it, right? And then there's an issue of we vaccinate a very small portion of the population. A lot of people go to their pharmacists for vaccinations or to the regular clinics.
Yeah, I got my flu shot at like the CVS,
Pretty much, yeah. And so, it's technically that's changed, right? So for COVID, it's a conversation with you whether you need a COVID vaccine now or not. It's not an automatic recommendation unless you've got other medical conditions that put you at risk.
I'm glad you brought up this word conversation, because that seems to be a big shift, which is now putting a lot of like onus on like the patients or the individuals themselves to make a lot of decisions. What do you think happens when like national guidelines and local guidelines don't line up? What's the issue there with vaccine adoption, or why is that an issue?
Right. And so we've seen this, right? And if you take a look at hepatitis B, I'm just going to stick to kind of the evidence we've seen in the past and tag it on to one vaccine, right? So when hepatitis B vaccinations became available at the start, so that was in the early 80s, hepatitis B vaccines became available, and we knew we had high rates of hepatitis B, like upwards of like 25,000 cases of acute hepatitis B every year. And if we narrowed it down to pediatric cases, it was about 10 to 15,000 pediatric cases every year of hepatitis B. So vaccine comes around in the early 80s. And so initially we said, oh, let's test high-risk pregnant women, and let's test to see if they have hepatitis B. And if they do, then, let's make sure baby's covered. And we didn't see the needle move too much in terms of how many cases we averted. And then so a couple of years later, we said, oh, let's screen all pregnant moms. Let's not just screen moms we think are high risk. Let's screen all pregnant moms. And we didn't see the needle move too much in terms of decreasing cases again. Then we said, okay, well, you know what? Why don't we just vaccinate? This vaccine is very safe. Why don't we just offer vaccines to everybody? So in 1991, we said, let's just universally vaccinate all babies when they're born. And when we did that, so from 1991 to the past 2 decades, we saw a 99% reduction in acute hepatitis B in kids.
Okay.
So, yeah, wow. I mean, every time, whether the onus is on the patient or the onus is on the provider to actually have these nuanced discussions, yes, once conversations are in play, there's a lot more human nature added into it in terms versus just let's universally recommend something.
And I just will say full disclosure, I am a mom to a toddler. And so very recently, I have had to also go through all these conversations and do the research and try to understand. And look, I'm not a scientist. Like I'm trying to like understand and navigate my way in the world, but I think have a healthy respect for science. But it's been like really interesting for me as a mom navigating these like mom Facebook groups and, seeing the comments, sections. I think people are really understandably afraid and mistrustful of institutions, maybe more so than they've ever been before. How do you have conversations with people about, you just described a bunch of statistics to me, but how do you have conversations with people when they come into SNHD about vaccines?
Yeah, so I do clinic as well, like separate from the district here. Immunization clinic is handled by our amazing nurses who do this every day and have these conversations day in, day out. Yeah. But it's, it's really having that mindset of understanding kind of where the patient or the parent is coming from. You naturally want the best for your child, right? And I think it's acknowledging that fear and sort of discussing, trying to get to the root of what the concern is and then addressing that specific concern.
I will say, like, sometimes, and it makes me sad, the conversations can get so like vitriolic and like angry, and it's from people on both sides of this debate, whether or not to vaccinate your children. And it seems like there's not really a space for people to learn or listen. So when you're coaching your nurses or talking to people in the immunization clinic about how you talk to patients, what is your advice around those conversations?
Yeah, so that's funny that you mentioned that. We just did kind of a recorded presentation for Clark County Medical Society that kind of talked about what does it look like to do motivational interviewing and kind of leave that judgment out of the room, regardless of how burnt out you are. If it's the 5th patient you've seen that day who's told you no about a vaccine because of some misinformation they saw.
Right.
Yes. Heavy metals or some misinformation they heard online. And yeah. And what does that look like? So it's really just redirecting the conversation back to, acknowledging their fears, acknowledging what they're reading, asking, okay, well, if it's misinformation, kind of, okay, where did you get that? And let's go take a look at the information, where you're getting your information, where I'm getting my information. Let's see where we can meet.
Well, let's come back to what's going on locally in Southern Nevada. What do we know about our vaccination rates? Because something I've been thinking about a lot is how vaccination rates seem to mirror like our country's partisan politics. The redder a state, the lower the vaccination rates tend to be. But interestingly, Nevada is quite purple. So I'm curious where we stand in terms of our vaccination rates.
So first of all, nationally, the rates are sort of just declining nationally.
Okay.
There's a really great dashboard that the CDC has that shows that information. So Nevada's at about, in general, for all vaccines, at about a 90%, 91% coverage.
And that's for adult and child.
This is actually school vaccination. So it's kind of hard to keep track of childhood vaccines. People move from state to state. And so one of the good ways we were able to measure it that's stable is school vaccination rates and coverage. It's like, what does it look like when kids are in kindergarten, when they're in 7th grade, and in high school? So, like I said, Nevada's at about 90%. So name me a state you want me to take a look at. And
all right, we got to compare ourselves. Okay, how do we stack up to California, first of all? Yes, our liberal neighbor.
So California's rates are still, according to this, at about 95%. So I'm talking about an average because this breaks this down by whichever disease. So like measles or hepatitis B. So it's anywhere from 95 to 97%. That's California.
Okay. So how do we stack up against, let's do Arizona next.
Okay. So Arizona, again, they're anywhere from, depending on the condition, anywhere from what I'm seeing on the CDC website, 88 to 93%.
Okay, that does kind of line up with my assumptions. All right, now what about Utah? I am curious about Utah.
To all our neighbors, I'm just reading off what I'm seeing.
Great, and if you're listening, why don't you can play along? Guess if you think you know what the number is. What do you think, Utah?
Yeah, Utah, the vaccines that are here in the school vax dashboard, 88 to 90%. 87
so
to 90%.
Interesting. So when it comes to vaccination rates, Nevada is actually quite purplish.
Yeah, we're kind of in the middle.
That's really interesting. That is really interesting. I guess what I am curious, though, because you said that vaccination rates are going down across the board. It sounds like it's going across in every state and nationally. What are some real-world examples of what happens in a community like ours when vaccination rates go down? What are the consequences?
So I'm sure last year you kind of saw in the news all the measles cases that we were seeing. And that was, 2025, we had over 2,000 cases nationally, which is huge. We also saw, and this is not just locally in the U.S., so we saw a little bit of a decrease in vaccination uptake during COVID. People weren't going out to get vaccinated. It's kind of hard to get to a doctor, right?
Sure.
And so you'll have pockets of stories of, vaccine rates dropping for polio, and suddenly you see a rise in cases. So.
But we don't have measles in Southern Nevada yet, right? That's not something we should be worried about yet?
We had one case last year.
Okay.
Yeah. We haven't had an outbreak.
We haven't had an outbreak. Okay. I'm knocking on wood right now.
Knock on wood. Exactly.
Yes. I'm knocking on wood. Yeah. So, but what else happens in a community? What are some of the risks and consequences when vaccination rates go down for a community?
So, obviously, when vaccination rates go down, it increases the risk of people acquiring it. And once people acquire it, increases the burden to the healthcare system, right? If they have complications from being ill, it puts a burden on our hospitals or healthcare providers, and the economy suffers as well. Yeah.
It's just a chain reaction at that point. Yeah, for sure. Aside from these diseases or these
vaccine preventable diseases.
Yes. Aside from these preventable diseases, what other communicable diseases are you concerned about here in Southern Nevada?
Yeah. So again, the vaccine preventable diseases, we can lump it all, and although we associate it more with childhood illnesses and like that huge schedule that kids have to take, there's also sort of that other population as they get older who get sick, hence the flu shots for our elderly population and whatnot. But other communicable diseases that we take a look at really kind of skew, and this is typical bread and butter public health, right? We usually keep track of sexually transmitted infections. And Nevada is always ranked a little bit higher in a lot of the STIs.
Oh, interesting.
And congenital syphilis. So tying it back to kids again, our congenital syphilis rates are also quite high.
When you say congenital syphilis, how is that connected to kids? Is that something that gets passed on from mother to baby?
Correct. So mom has syphilis and she didn't know she had syphilis, so she gave it to baby. It got transmitted. Yeah.
Oh, wow. Okay. So as you've seen a lot of cases, you're observing a lot of the health trends across the community. What are some of your recommendations for how we can keep ourselves and our families safe and healthy?
Right. So you can only control what you do for you and your family. So, read the information, read the science, talk to your trusted healthcare provider. So I think the most important thing is finding a healthcare provider you can trust in a safe space where you can have these conversations and talk about what's safe for you. The recommendations are there so we can protect not only your family, but the whole community as well. And so just making those decisions about vaccines, but also understanding other preventive measures, right? So when it's respiratory season right now, so it's basic things you probably teach your kid that we learned in kindergarten, cover your cuffs and sneezes, wash your hands.
Yeah.
Those things don't change, right? Really staying home when you're sick if you can, a little bit harder to do sometimes when you're at work.
Sure.
But yes, just those basic things that help stop transmission are huge.
Yeah. I almost wonder too if there's almost like a harm reduction approach to low vaccination rates. Like if you can't convince someone to sign on to all vaccines, can you convince them to sign on to some of them? Or if what is maybe a harm reduction approach to this vaccination issue?
Absolutely. This is not a new thing. And I'm glad we're having these conversations out in public, but these are things that have been happening behind closed doors, doctor-patient wise. Like I've been having these conversations with my patients for years, and vaccine hesitancy isn't new. There's always questions. There's always concerns. This goes all the way back to MMR vaccines and autism. So we've had these conversations for years with patients, and you're right. It is a little bit of a harm reduction approach. And as much as I want to say, here's the 10 vaccines you need today, if I can't get them there, then we're going to talk about what's okay now and what does that look like. So, and really, I try to couch the conversation in, at least for pediatric vaccines, acknowledging that our goal is to keep your child safe. My goal is to keep that child safe. And what does that look like? And moving on from there.
Right, right. Do you have any parting words of advice for, let's say there's, a mom in your Facebook group or a parent at your kid's school who, comes across as very anti-vaccine, or there's just even in whether it's in-person or online conversation, what are your parting words of advice for people who maybe want to interact with vaccine deniers or people who are vaccine hesitant parents in their social circles?
It's challenging. If somebody decides to engage, you just have to be prepared for whatever type of response you might get. It's usually a better conversation one-on-one than one that's done sort of in that social media space with a whole lot of
audience
opinions.
Yeah.
Yes.
Yeah.
And then it gets heated. And really, I think what I've learned is I don't really want to have that conversation and have the person feel like I've backed them into a corner, and having that conversation with that wide audience sort of lends itself to that situation probably happening. So it's hard. It's not all about science. So really a lot of these decisions, a lot of the hesitancy, and you mentioned it, is about worry, right? It's an emotion. It's not all just about science, and it's trying to understand where people are coming from and having that discussion.
Yeah. Well, the art and the science of vaccinations, Dr. Sugay, thank you so much for bringing your important perspective here on CityCast Las Vegas.
Thanks for having us.
And that's all for today here on CityCast Las Vegas. If you enjoyed the show, hey, go tell a friend, rate the show, leave us a review, and subscribe to our morning newsletter. Don't forget you can support this show and get some great perks by becoming a CityCast Las Vegas neighbor at membership.citycast.fm. We'll be back tomorrow morning with more news from around the city. Take care.